Think you know what an epidural really means for labor? Most women don't, and it's hidden details that can make or break your experience. So here are 3 things about epidurals no one's explaining, but every mom deserves to know before she says yes. Hey girl, hey, it's your birth bestie, Nurse Rini, and I am back with another fabulous video for you. Yes, girl, you come on into the birth prep lounge where we get down into the weeds and the nitty gritty, and we talk about all of the things, labor, delivery, and postpartum in the hospital that no one else on the internet is talking about. So today we are going to talk about epidurals. Yes, the epidurals. Now, I know the girls out in the street are trying to make y'all believe that they are doing this thing unmedicated, and that's great for them if they are, but most women, about 75% of women in the United States who have a baby, use an epidural. So you are not alone in this, and we are going to talk about some of the things. So after all of this time I've spent at the bedside, I want to go ahead and give you these 3 things by the end of the video that you can take away about epidurals in labor. So number 1, you can get an epidural anytime you want it. You can get it early, you can get it late. As long as you are not crowning when you are requesting it, you can get your epidural. So oftentimes I am asked, how do you know when to get one? My thing is this. I see women say, oh, I'm gonna wait until I'm 8 centimeters. I'm gonna wait until I'm 6 centimeters. My only caveat is do not wait until the 11th hour to get an epidural. Right? If your goal is rest and pain relief, then get it when you start to feel uncomfortable, knowing that it could become considerably more uncomfortable. The one tip that I like to offer my friends is that if you are already in labor, meaning you're having regular contraction patterns and you are changing your cervix, and the doctor says, hey, let's get this ball rolling even more. Let me go ahead and break your water. That's when I would say, if you know you want to get an epidural, get it before they break your water if you're already in a regular contraction pattern, because it's definitely going to ramp it up much more quickly, much more intensely once your water is broken. If your reservations are surrounding fear of getting an epidural, then I would definitely recommend you calling the anesthesiologist into the room and having a conversation about what an epidural is, what it means to get it, how it all works, and all of the things. Of course, we do go over these things in our online module, and I also do it in my virtual live classes. But this is something that I definitely recommend, because to not get an epidural because you're afraid to get one is going to just make the whole process much more difficult for you. A lot of the concern is surrounding whether or not epidurals slow down labor. And really the research has shown that it doesn't slow down labor like we think it does, or like you think it does, because it doesn't. It may delay labor maybe by 30 minutes or something, but if that's 30 more minutes that you can rest, then hey, why not, right? If that's your goal. So I would definitely say steer clear of the falsehoods that says that epidurals slow down your labor, because I've actually seen epidurals speed up some people's labor because they're able to relax and let birth flow and happen. I've been a labor and delivery, postpartum, NICU, fertility, and Army Nurse Corps veteran for about 17 years. So I have quite a bit of knowledge in this field. So I'm gonna go ahead and tell you some of the things that happens when you decide to get an epidural in labor and delivery. Number 2A. Getting into position for an epidural is probably the hardest part, but 2B, the other hardest part, is probably going to be sitting still through those contractions that you are sure to have while you're getting your epidural placed. So when you get an epidural, they want to get into the spinal space, right? So we remember from science class when we were kids, right? They talked about, the back and the spine and the vertebrae, right? Those bones stacked on top of each other. The doctors and the certified nurse anesthetists need to get in between those bony spaces. So what they have you do is curl around your baby. So what they'll have you do usually is hold a pillow or hug your nurse, and you're going to open up your back, open up your spine by bending over your tummy. So that's something I would definitely practice. For those of you who are growing exponentially in this 3rd trimester and your belly's just getting bigger and bigger because our fabulous baby is getting bigger and bigger, you know how challenging that may be to do. So just keep that in mind, that you do have to be able to get into that position and maintain that position throughout the placement, throughout the procedure. Now, 2B, you will have contractions if you are already in a regular contraction pattern, meaning you're contracting every 5 minutes, every 2 minutes, every 3 minutes, every 7 minutes. You're going to have contractions while your epidural procedure is happening, while you're getting the epidural placed, and you cannot move. You still must keep still. So just keep that in mind. And that's one of the reasons I say get it before your water is broken if you're already having regular contractions, because once your, contractions hit that water is broken, it may be much more uncomfortable and you may not be able to keep still as easily as before the water was broken. So that's just my 2 cents. I had a patient one time and, we talked about the epidural because she knew she wanted one. And I said, get it before they break your water. She didn't listen to me. Okay. I don't push things on people. Like, do what you want to do. I'm just going to give you the information based on my knowledge, my expertise, my studies, my experience in this field, right? So I've worked with so many patients and she did not listen to me. And let me tell you, she was like writhing in pain when it was time to get her epidural, which was shortly after her water was broken. So just make sure that you keep that in the back of your mind. You do not have to get it before your water is broken, but keep in mind that one of the things that I think people don't always realize is that just because you want an epidural now doesn't mean you can get it now. And I'm going to throw that in as a bonus at the end. Okay, moving on. So if you have a great provider, a great anesthesiologist or nurse anesthetist, they should hopefully be walking you through what they are doing. And I remember teaching a module at a baby expo that I went to that's heavily education focused that I loved. And I showed people what it looked like, what they were going to be doing. And someone was like, that looks scary to me. I said, valid, valid. However, everyone else knows what this looks like, but you, and it's being done to you. So I want you to see what's happening so that you can have an idea of what's going on behind your back. No pun intended. Or pun intended, right? Yeah. So anyway, definitely anesthesia should be walking you through the process and letting you know what's happening. And your nurse will help you maintain that position. But again, you want to curl around your baby, curl around your abdomen, drop your shoulders down, curl the head down, and open the spine up. If you have a great and skilled anesthesiologist or CRNA, then the placement should not be too challenging. They should be able to pop it in all the time right away. It's rare that I've seen, providers on labor and delivery struggle with placing an epidural. But for those that I have seen struggle, they don't always sit on labor and delivery, or they aren't like OB specific anesthesiologists. And we talk about that in a module that I have that's free. So let me know if that's something you guys are interested in. But I talk about different levels of providers and different levels of maternity care. But hopefully placement is quick. I used to love this one anesthesiologist or nurse anesthetist who would place the epidurals while the mom was laying down on her side. So it was still comfortable for her. It was easier for her to maintain that position while she was contracting because she was able to lay down on her side. But that is definitely a skill, and that is very uncommon to have someone let you be side lying while getting an epidural. So just keep that in mind. Number 3, not all epidurals work well. I know, it's shocking and surprising, but what'll happen is after you get your epidural, your nurse and the anesthesiologist will be checking in on you and asking your pain level and asking you if it's getting better. It's kind of black and white. I would say definitely it should be black and white. Like, is it getting better? If you're like unsure about whether or not it's getting better, make sure you let them know. Like, I don't know. Like pain may not completely go away, but you should feel a noticeable difference. So definitely they will be checking in on you. Sometimes we can have what's called a window or a hot spot where the epidural does not block all of the areas it's supposed to. So you may feel great everywhere else except this one little part on your side in your pelvis where you feel every contraction just like you don't have an epidural placed. And that does happen. Now, sometimes they can work with that and like reposition you and see if they can get by gravity the epidural medication to go to that spot. But there is the rare occasion where an epidural will have to be replaced. So know that that is a thing. So if you're not getting pain relief and they just keep trying to dose you and keep trying to fix it and it's not working, just ask them to replace it if you're open to that, because it probably just needs to be replaced. What happens is when the epidural catheter, which is plastic, gets into the back, it can migrate any which way. So it may migrate more to one side, and that means you're only getting medication on that side. Now, to give you a little bit of a story that doesn't have anything to do with labor and delivery, but to give you a comparison, right? I've had LASIK, right? And I had LASIK like over 10 years ago, but I remember my vision was perfect. It was like more than perfect right after the procedure. And then like as a couple of days went on, a week went on, my vision in my right eye started to like not be as perfect. And the doctors kept telling me, oh, I mean, it's not going to be perfect. It still looks good, you know. It's not going to be as sharp as it was right after the surgery, but it looks good. And I'm like, listen, at this point, I need you to give me a prescription for glasses. Because this eye is not good. This eye is not right. Like, I know it on paper it may look good to you, but what I'm seeing, it's not it. It's not it. And so once I asked for glasses, they were like, oh, I guess someone wouldn't go through this whole procedure just to get glasses again, right? So you might just have to let them know you're not looking for perfection with an epidural. If you have relief, great. But if you don't, then you want to definitely make sure that you are telling them, like, this spot right here or this whole left side, I can't deal with the pain there. Like, this needs to be remedied. Again, there's no point in sitting for an epidural and it's not working. So definitely let your nurse and your doctor know. Okay, and the last thing that's a bonus that I'm going to throw in here, like I mentioned earlier, and I share this in my class, so you guys are getting some insider tea, okay? I'll be appreciating, girls. Is that just because you ask for an epidural now, like, okay, I'm ready, it's getting uncomfortable, I'm ready, that doesn't mean the person's going to come. It definitely, absolutely, 110% depends on what's happening on the floor. There could be a C-section going on, there could be another epidural being placed. I've seen, because where I've worked, we've had many beds, well over 10 beds in our units, in all of the units I've worked on except for one. And we have had epidural 1, epidural 2, epidural 3, like we've had them lined up. So just because you ask for one at this moment doesn't mean you'll get it. So just keep that in mind when we're thinking about when you might want one. You may want to keep in mind that you may not be able to get it when you want to, you may not want to break your water beforehand. So there are just so many different things you want to consider. I also always share not to ask for it at change of shift, because we're changing shift and you'll probably have to wait until after change of shift. And then there may still be a line. So is that right? You know, you also don't want to necessarily start a procedure and then have change of shift happen, because then that can be a safety issue sometimes, right? So you know, that's one way to think of it as well. But guys, I hope this was informative for you. So to recap, the 3 things: you can get the epidural anytime you want as long as you're not crowning, okay? And a spin-off of that is it won't slow your labor down. Number 2, the positioning is the toughest part, right? And maintaining that position. 2B was that you may contract and you still have to sit still and maintain that position. So all things considered, people are afraid of the needle. The needle ain't it. It's contracting and having to maintain that position so that something doesn't happen because you moved. Number 3, epidurals are not perfect. So you may sometimes need to finagle it with the providers, or they may just have to replace it. And I would say it's worth it if you're wanting pain relief or it's becoming too unbearable for you. So if this video helped you at all, if you learned something that you did not know, then definitely make sure that you follow me for more information like this. Again, I've been in the game for a long time now, ladies. So I am your go-to girl. I'm always going to keep it real. Okay, and I'm always going to let you know what's going on so that you have a realistic understanding and viewpoint of what actually happens in labor and delivery when you go into the hospital. Share this video with someone else that you know who may want an epidural, or may be on the fence about it, or just is skeptical about epidurals because they don't have a lot of information on it. And if you want to go deeper, my childbirth education course offers all of the things that you need to know. You can find us at yourjourneybirthcollective.com. So my darlings, make sure that you, again, like, comment, share, follow, subscribe, all of the things, and I will see you in the next video. Bye.
Now where do we go from here?